everybody, this is Dr. Forth, and today I'm actually talking about shoulder pain. Did you realize that the shoulder actually has a complex of several different joints? So we have here the ball and socket joint where the head of the humerus fits into a little socket at the shoulder blade. We have a shoulder joint at the top where the shoulder blade meets with the collarbone, and we have a joint here that's really part of the shoulder complex where the collarbone attaches to the center of the sternum. And then there's the area on the back side where the shoulder blade actually moves back and forth over the chest wall. So when we talk about shoulder, we're talking about all of those different things. And when we think about the main joint of the shoulder, which is the one people most often think of when they're talking about shoulder joint, it's a ball and socket type joint where the head of the upper arm bone fits into a socket on the shoulder blade. The hip joint is the same kind of joint, except if we were to look at the skeleton, you could readily appreciate how the socket for the hip joint is much, much deeper. And so it provides some bony stability for that hip joint. The shoulder joint, the socket is just tiny, tiny little area on that shoulder blade. Now, we do have a cartilage ring called the labrum that helps to add a little bit of depth to that, but still, there's not really any bony support for the shoulder blade. So that means it's all soft tissue structures that are responsible for the stability of the shoulder joint. And so you can have a lot of discomfort with soft tissue injury from traumatic injury or overuse type problems. So some of the things that happen is dislocation and tearing of maybe the joint capsule, which is a membrane around the joint, or that little cartilage ring called a labrum. And those usually require an orthopedic consult and perhaps even surgery followed by rehabilitation. And rehabilitation is going to be very, very important. The work for the healing is not done when the surgery completes. So make sure that you do your rehab work if you've had one of those kinds of injuries. Impingement. This is where you get some swelling of the tissues and perhaps compression of those structures. A lot of this happens from overhead type work. You think about the shoulder joint, we actually have a bony area that comes over the top of the shoulder here and some soft tissue structures, muscles, nerves, blood vessels pass through there, and you can get compression of those structures. And as I said, very often it's from overhead type work. This responds really well to conservative treatment. Rotator cuff problems. You've probably heard of the term rotator cuff, but what is it? It's muscles that are attached to the shoulder blade that come out and attach to the head of the upper arm bone. And there's different ones that allow for movement of the shoulder in different directions. And so, depending on the degree of dysfunction, if it's significant tearing, you might have to have surgical treatment, but often it can respond to conservative treatment. And so we can do a lot of things to help with that ourselves. Most common rotator cuff muscle to be torn is the one that goes across the top of the shoulder blade and back. That's called supraspinatus. Comes across and then it reaches out and connects to the top of that bone. And essentially, this is the action that that muscle does. frozen shoulder, also known as adhesive capsulitis. We get pain and loss of motion, particularly at the ball and socket area of the shoulder joint. This one's tricky because there's a lot of inflammation there, and you want to mobilize that joint with increasing amounts of mobility, but then we have to, pardon me, then we have to make sure that the resulting inflammatory response doesn't cause more scar tissue and decrease range of motion. So it's a delicate balance. You want to mobilize the joint, but not so much that you trigger a big inflammatory response that's going to make that decreased range of motion worse. And you can also have shoulder problems from poor posture. I think I mentioned in other videos about the computer troll position, right? Rounded shoulders, forward head position. That really puts a lot of stress on the neck and on the shoulder area. So these different shoulder problems have a lot of common treatments that work for them. First is stop doing the offending activity. So maybe a bit of rest, but not immobilization. Remember, even with the frozen shoulder, complete rest is going to result in complete loss, or not complete, significant decrease in range of motion of that shoulder. So we want to rest, but not immobilize. You can alternate heat and ice, and Epsom salt is a wonderful thing for soft tissue problems. Now, it's not exactly convenient to, try and submerge the shoulder for an Epsom salt soak. So really cool trick, I mentioned it in another video, is kind of like an Epsom salt soak. So you're going to lay down on top of a towel and moisten the area, and then sprinkle Epsom salts over it, and then put a warm, moist washcloth or towel over the top of it. So it's kind of like doing a soak, but you don't have to submerge the shoulder. This is great. And by the way, these are general informational kind of recommendations. If you have a specific shoulder problem or certain conditions, health conditions, where you can't use heat or ice, you definitely want to consult with your doctor who knows your specific condition, and they can advise you specifically for you. This is general information. Also, inflammation makes pain worse, because with inflammation, you have chemistry released into the body, and that makes the different receptors and nerves more sensitive, and it absolutely increases pain. So any kind of painful condition benefits from actions to reduce inflammation. And so several of the things we can do: reducing sugar consumption. Sugar directly increases inflammation. Anti-inflammatory things that you can add to your diet: ginger and turmeric. Actually, the component of turmeric that is anti-inflammatory is called curcumin, and it is fat soluble. So you can actually use turmeric is that yellow spice that you see in a lot of curries, and actually the fatty material in most curries, like the oils and so forth, that's really important because the curcumin is fat soluble. So taken with oil helps you to increase absorption of that. Any kind of soft tissue injury benefits from vitamin C. Vitamin C is very important for collagen production. What's collagen? Collagen is a protein that is found in lots of things: your skin, and connective tissue. And so when you damage soft tissue, you have to repair it and produce more collagen. Vitamin C is an essential component of that. You can find vitamin C as tablets, but it's also in all raw fruits and veggies. And so that's a great thing. Now, make sure that you don't have a whole bunch of fruit because that's going to increase sugar and potentially increase inflammation. Some specific exercises for the shoulder. The first one, I call it pendulum exercise. So you hold your arm out like your hand is a plumb bob, and you just let it dangle, and you lean over and you let it make little circles, figure eights. This is kind of like the beginning shoulder exercise. Okay, so just some light mobilization. And then you can also do things like crawling up the wall with your fingers, like there's little steps. To crawl up the wall, you're going to have to stand far enough back from the wall that you can extend your arm and just use your fingers to crawl up the wall. Wall angels. I've mentioned this in another video. If you live in an area where there's snow, perhaps you've gone out after a snowstorm, especially when you're a young kid, and made snow angels. So you lay down and then you move your arms and legs. And when you get up, if you don't mess up the snow angel, I always had trouble with that. If you don't mess it up, it kind of looks like an angel. Well, we're doing this up against the wall, and we don't care about moving the feet so much. So you're going to stand up against the wall with your back against the wall, your shoulders against the wall, and your head against the wall. And you turn your hand, obviously take off your jewelry, okay? Or at least turn it around, because we don't want to make a trench in the wall. We don't want to scuff our rings. But you're going to have your hands flat up against the wall and move your hands like this. I've got a little bit of a space constraint here where I set up my camera. Oops, poor planning for shoulder exercises. But anyway, you can do that against the wall. A lot of the work that we do is in forward flexion. So these muscles in the front get tightened, right? And imagine the muscles on the back get stretched and weakened. So we want to release these muscles. Remember, we don't ever just do stretches without accompanying strength exercises. So you do these stretches in conjunction with the wall angels, and that will help you. In fact, it might work better if you do that first. So there's stretches for the pectoralis muscle. We have pec major and pec minor. Pec major covers most of the chest. The pec minor is thin strip that just goes from a little bony part here and reaches down to cover. Did you know that pec minor is where chicken fingers come from? So that's the pectoralis minor muscle of the chicken. Who ever heard of chicken having fingers? Most of the time when you purchase chicken breast at the store, they've already taken out the pec minor to make chicken fingers, and that's what that muscle actually is. You've seen some of the chicken breasts in the store? They look a lot more like pterodactyl breasts. They're huge, but I digress. So the pec muscle, it covers much of the chest, and so you could target different fibers based on how much you raise your arm when you do your pec stretch. So you're going to stand and put your arm up against the door frame or tall furniture, and you're just resting it there. You're not pushing with this arm. You're resting the arm there, and you just lean a bit forward. You should feel a nice stretch. So you can slide your arm up or down to get different muscle fibers in that pec group. So again, we're not pushing with this arm. You just lean a bit forward. So you might do that pec stretch before you do your wall angels. And if when you get ready to do the wall angels, just getting into the position is challenging for you, then that's where you stop. You just get into position, and eventually it's going to become easier as that tissue loosens up, right? So you get into position, and eventually you'll be able to do those wall angels. But I suggest the pec stretches first. Another thing that's good is retraction of the scapula. What does that mean in English? Well, here's the scapula or the shoulder blades, and we have muscles that bring them together for, your upright military attention posture. So you can retract them, or you can use something like this. This is an exercise band, and you can get them in different strengths. This particular red one is like a mid-range. You can get really, really lightweight ones. The ones that are gray or black are really strong. So what we're doing here, we're just going to pull our shoulder blades together. Again, I did not choose wisely where I set up my camera because I don't have just a whole lot of room to move this hand. It's okay, you get the idea. So here is our band, and we're just pulling our shoulder blades together. The band gives us a little bit of resistance and also kind of helps us to make sure that we're doing the correct motion. So all of those things are going to be helpful for your shoulder. Lots of people carried their stress in their shoulders. Oh my goodness, during the financial crisis in 2008, when I had realtors and bankers coming into the office, I swear that their shoulders and ears were, attached because they were so stressed out and holding the shoulders up. These muscles can get chronically tightened. So we want to stretch them and bring them back into appropriate biological functioning position. Make sure that you take stretch breaks throughout the day. Now, if you work at a computer, you could set a little alert. I've been practicing with my tablet times that I have a lot of work to do at the computer, insurance billing, and who does not love that? Uh, Setting an alert on my tablet so that I get up and stretch periodically. I set it for like 45 minutes. You can do it once an hour or every half hour. I understand that some of you may be kind of glued to your desk for your work and you can't get up and walk around, but at least you can stand up at your workstation and take a little stretch break. So make sure that you're doing that. There's a lot of things that you can do to help your shoulders with the different exercises and nutritional recommendations that I've made. In my office, I adjust shoulders and I also do PNF stretching. I like to use therapeutic ultrasound and red light therapy. Sometimes people also need taping for stability, so that's another good thing. But there's a lot of things that you can do to help yourself, which I have highlighted here in the video. And make sure that you like and subscribe so that you can see my next video.